Hey everyone, welcome to the BioScan Hub channel. If you like what you see, please don't forget to subscribe. It really helps support us. Okay, let's dive into one of the most critical and honestly one of the most elegant systems you're going to encounter in the lab, coagulation. We're going to break down the entire process of hemostasis, all the way from the initial trigger of an injury to the diagnostic tests that you'll be performing.
So think about this for a second. How does your body pull off this incredible magic trick? It has to stop a bleed, but without, clogging up your entire circulatory system. It's a super high-stakes balancing act, all about forming a clot exactly when and where it's needed, and absolutely nowhere else. So here's our game plan. We're going to start with the core concept, this idea of the balancing act. Then we'll walk through the 4 main stages of the cascade. After that, we'll look at what happens when it all goes wrong, and finally connect it all back to the amazing detective work that happens in the laboratory. All right, Section 1, the big job of hemostasis. It's all about protecting the integrity of our blood vessels while keeping our blood fluid enough to do its job. Let's dig a little deeper into that. The really crucial thing to get here is that hemostasis isn't just a passive state. It's an active, ongoing process. Think of it like a scale, perfectly balanced between things that promote clotting and things that prevent it. An injury is basically the trigger that intentionally tips that scale, kicking off a super fast, localized response right where it needs to happen. Okay, so how does the body actually pull off this amazing feat? Well, it uses this really elegant 4-stage cascade of events. Let's break it down step by step. First up, and you could argue it's the most critical stage, it's all about the platelets. They are the first responders, literally rushing to the scene of the injury. And get this phase is so important that a whopping 90% of all coagulation disorders come from a problem right here. Either you don't have enough platelets or the ones you have just aren't working right. Next, in stage 2, things really start to accelerate. The whole system amplifies to generate thrombin, which is the key enzyme for what comes next. And just look at the speed here. We go from a process that takes a few minutes to one that happens in just a matter of seconds. Incredible. And this is where it gets even crazier. Stage 3 is almost instantaneous. Thrombin gets to work and creates this fibrin mesh that stabilizes the whole plug. We're talking 1 second. It turns soluble fibrinogen into a solid fibrin framework, basically locking everything into place. And finally, once the vessel is all healed up, the cleanup crew arrives. Stage 4 is all about making sure that clot gets dissolved so that normal blood flow can be restored. This process, fibrinolysis, is every bit as important as making the clot in the first place. You don't want a permanent roadblock, right? But what happens when this perfectly balanced system breaks down? Well, the consequences can be pretty severe, leading to one of 2 opposite and equally dangerous problems. So yeah, the system can fail in 2 completely opposite ways. Either you can't form a clot properly, which leads to bleeding, or you form clots when you're not supposed to, leading to a dangerous thrombosis. Both are life-threatening, and both need some serious lab investigation to figure out. What's really interesting here is that while inherited disorders like hemophilia get a lot of the spotlight, most of the bleeding problems you're actually going to see in the clinic are acquired. Things like thrombocytopenia, which is just a low platelet count, are way more common causes of hemorrhage. On the flip side, you've got hypercoagulability. This can be driven by platelets that are way too reactive, which often leads to clots in the arteries, or by an overactive clotting system in general, which usually causes clots in the veins. Okay, so we know the problems. Now, how do we figure out what's actually going wrong inside the body? Well, this is where you, as a future lab professional, come into the picture. This is your detective work. Your investigation is going to start with this panel of 5 primary screening tests. Think of these as your first set of clues. Together, they give you a really broad overview of the whole system. The PT, for instance, checks out the extrinsic and common pathways, while the PTT looks at the intrinsic and common pathways. These are your opening moves in a diagnostic chess game, helping you zero in on where the problem might be. Now, this is a number you absolutely have to remember, the critical platelet count. If you see a count below this, the patient's risk of spontaneous bleeding goes up dramatically. This is one of those numbers that should make you stop in your tracks when you see it on a report. So, the bleeding time test.
What's it for? Well, it directly measures that first phase of hemostasis, how well the platelets are interacting with the blood vessel wall. It's a fundamental test of how well those first responders are actually doing their job. The IV method is a classic procedure, and you'll need to master it to get accurate results. Inflating that cuff to 40 millimeters of mercury is key because it makes the pressure in the capillaries the same for every patient. And when you blot, this is so important. You have to make sure you only touch the drop of blood, not the wound itself. If you touch the wound, you could knock off the fragile platelet plug that's trying to form. And here is the critical value for this test. Patient safety is everything. If the bleeding goes on for more than 15 minutes, that is a major red flag. You have to stop the test, apply pressure, and report that result immediately. So let's bring this all home and really drive home why understanding every little detail of this cascade is so critical for the work you do in the lab. This clinical alert from a textbook says it all. It highlights the direct, unbreakable link between your work on the bench and the actual safety of the patient. Your results aren't just numbers on a screen. They are a form of active surveillance that guides clinical decisions in real time. At the end of the day, understanding this whole cascade is what lets you correctly interpret test results. It lets you provide those crucial diagnostic puzzle pieces that doctors need to manage their patients' care. You're not just running tests, you are solving a complex biological mystery that directly impacts a person's life. To leave you with a final thought, let's try to apply what we've learned to a classic lab scenario. A patient has a prolonged PTT, but their PT is totally normal. Okay, knowing that those tests measure different pathways, where in the cascade would you start looking for a problem? Well, a deficiency in factors like 8, 9, 11, or 12 would give you this exact picture. Think about why that is. Thanks for watching.